my wife had had a hip replacement about 20 years earlier, and that chap had retired. So it's sort of a natural starting point, really. And so it was a matter of starting from scratch, looking up people. So I started to do some research, really, and looked up. He said, look for people who do a lot of them, you know, who have got enough experience, you know, enough time under their belt, as it were, and look for a place that does lots of them. And that's when I latched on to the sort of robotic thing. And I was looking for volume. I came across James, who seemed to do an awful lot of them, 3 times more than the average at the time. Maybe it's more than that now.
So most patients who've come to me in the private sector, I'd say over 90% of people have been on my website. They've looked at the fact that I do between about 250 to 300 joint replacements a year. And they've also looked at my National Joint Registry data as well. So that's really robust data that tells you what your revision rates are as compared to everybody else. So yeah, they've really researched in quite a lot of detail, and consequently you get people coming from all over the place coming to see you, which is quite complimentary, really. So I think the robots I use as an additional tool to all the things that I do already. So I do a lot of hip replacements, and the various checks and measures and checkpoints that I use as my standard practice for doing hip replacements. And the robot is another tool to help me get things even more accurate and reproduce what your anatomy should be to hopefully improve your functional outcome following your hip replacement.
And so we're 2 years on now.
Yes.
How would you describe it now?
Well, I don't really know I've got it. Actually, I've forgotten about it. And I've got a huge range of movement in it, so I really don't give it much thought. I golf a bit, and that's no problem for golfing. It's a left hip. Mine was a left hip, and so that gives me no difficulty at all. I've never had any pain from it at all.
Which is perfect.
It has been a huge success, actually. I shouldn't have perhaps been as nervous as I was to begin with.